Good morning, good afternoon, good evening. Welcome to Daily News, Everyday News, Breaking News on Prince Miller Entertainment TV. Subscribe to the channel. Follow us on all our social media platforms on Instagram, Prince Miller Entertainment, Facebook, Prince Miller Entertainment Facebook group, Prince Miller Entertainment TV. We're available on Twitter. It's a P Miller ENT. Today is the 23rd of November 2021. And so guys, here's the latest. Human rights organizations are concerned about policy changes affecting immigrants since the Gauteng Health Department gazetted them in June last year and issued a circular in May 2020. According to the organizations, medical care is being denied to asylum seekers and refugees if they are undocumented or have expired permits unless they can pay upfront fees. Hlingwe Mahlahla of Lawyers for Human Rights said the new fee structure is very high and foreign nationals end up being on the highest scale and are required to pay upfront. People with expired or no documentation have complained of being charged the highest fees or being turned away. They are expected to pay as if they are in private hospitals, even though they are in public ones. With no documents, they cannot even enter into payment plan, and they are also expected to declare their income, which is difficult in most cases. Asylum seekers and refugees are also being affected, especially those with expired papers. All efforts to engage with the department have been unsuccessful. Sibusisiwe Nlena Anatoni from Section 27, a public interest law center, said that since March 2020, the organization has had nearly 70 requests from immigrants trying to access health services. She said this influx of clients followed the circular. Nlela said there are regulations and policies with offending provisions that need to be set aside. Section 27 and the Lawyers of Human Rights says immigrants in need of medical treatment sometimes urgently are being turned away at Hubro Community Health Center, Yellowview Clinic, Charlotte Mahleke Johannesburg Academic Hospital, JEP Clinic and Kalafong Hospital, Pretoria. Immigrants also complain that they are treated disrespectfully and insulted by hospital staff simply because they are not South Africans. It is not the first time the Gauteng department has been accused of trying to exclude immigrants. A circular issued in January 2019 was withdrawn and heavily criticized of being not only a problem for immigrants but a threat to public health in general. Lela said this circular is an attempt to introduce the same position as was adopted in the circular that was withdrawn. The organization has been writing to hospitals on a case-by-case basis. She said the Gauteng guidelines on patient administration and revenue management is both unlawful and unconstitutional. It fails to consider the provisions of the Refugees Act, which says that refugees and asylum seekers have the constitutional rights to dignity and equality and to access health care. According to Andela, it also violates the National Health Act that requires the state to provide free primary health care services, and it is unconstitutional because it discriminates unfair on the basis of nationality and documentation status. Section 27 is considering litigation since it believes that state has created a policy intended to exclude immigrants despite their clear legal entitlement to health care. A woman who lives in Johannesburg and is undocumented says she's sitting with a bill for 35,000 rand after her 4-year-old child spent 8 months from June 2020 to January 2021 in Johannesburg's General Hospital for Burns. She says her child was discharged but still needs follow-up medical attention, but she avoids going back to the hospital because of demands for payment. Earlier this year, she went to Helen Joseph Hospital for treatment for herself but was asked to pay 350 consultation fee first. She stops going. I would beg on the street at the traffic lights and look for money to buy medicine at the local pharmacy. Even now, I'm healed, as she said. Another woman from Zimbabwe, who has been in South Africa for 10 years, says she was denied maternal care at JEP Clinic where she was pregnant because she's undocumented. She gave birth in October. They kept turning me back, giving the excuse that I had no papers and I didn't have any money. I was worried because my time was coming closer. When I went to Hubro Clinic at 7 months, they only gave me a card but did not even book me told me never to come back. She said when she went into labor, she got herself to the clinic. She said she was insulted by staff, but they eventually called an ambulance. The birth was complicated and she had to have a cesarean. Lela said that besides scrapping policies that exclude immigrants from accessing health care, the department needs to have a sensitization program to address xenophobic attitudes. For Samuel Gauteng, Department of Health spokesperson, sent us mostly one-line response to all our questions. He said, "We hear reports all the time, but we don't get sufficient information or evidence to enable us to investigate." He said the department treats immigrants and their children the same as everyone else, but as says in Lela, the informed patients fee schedule, which sets out the applicable patient classifications and fees for hospitals, provides for full paying patients and subsidized payments. Full payments patients are liable for the full payment of hospital costs and fees. Subsidized patients qualify for partial or full subsidization by the state. The fees are means tested, she explained. South African citizens usually are subsidized under the uniform patients fee schedule. SADC citizens, even undocumented ones, are subsidized the same as South Africans ones, but under the controversial circular, only documented refugees are treated the same as South African citizens. Lela said this means that the circular excludes asylum seekers and undocumented SADC citizens from subsidies. So guys, that's the latest here. If you're in Gauteng, if you're in Joburg, you know what I'm talking about. In yema hospitals kuti kana usina mapepa, sometimes vanoti unofana kutobhadhara mari first, then you can get treatment, and some want to kudzosera kuumba kuti, you know what, we are not going to treat you here. So many foreigners are now preferring kuenda kuma private hospitals where you're gonna pay and after getting treatment. So not all of us also can afford kuenda kuma private hospitals. Saka motona mega tipa nguwa yakaoma if you are undocumented immigrant here in South Africa, or even if you are an asylum seeker, because kuna ma hospitals nema clinics vanenge vasinga mutambira nokadaro, and saka motona mega tiripa ma one when it comes to nyaya health here in South Africa is immigrants. Tell in the comment section. This is daily news, everyday news, breaking news on Prince Miller Entertainment TV. We keep you guys informed about any new information. So we hope this won't spread to other provinces in South Africa, because this will affect most of our brothers and sisters who are living and working in South Africa, because as we all know that most of us we don't have those documents. Tina mapepa saka mutu nemega toti kuchipatara ko ndiwatenga chitongo ponero, but vari kuchema vachiti aiwa mawandisa, you guys are taking advantage of our hospitals, of our clinics, and muri kuwandisa, saka you need to pay first. Dzimwe nguva untonzodzokera kumba, we cannot help you because hauna any document which can show us here in South Africa legal. So guys, this is daily news, everyday news, breaking news on Prince Miller Entertainment TV. Thank you very much for listening and watching. Remember to turn on the notification bell so that you won't miss any of our new uploads that we upload here. Thank you very much for listening and watching daily news, everyday news, breaking news. Bless up.